Hi everyone, my name is Christine Cruz, and today I will be discussing structural thinking tools and tools to identify change. This is the second part of our week 5 presentations for our systems thinking course. So I would just like to thank Ms. Diane Martinez for she already discussed about the dynamic thinking tools earlier. So before I begin, I would like to ask everyone to think about the situation that we are always encountering in healthcare or at times encountered in healthcare. So let's imagine the patient that arrives to the ER and then suddenly the patient had neurological symptoms. So as a nurse, of course, we need to perform assessment, recognize the urgency, and then coordinates the care. Then for the rad techs, of course, they need to do the imaging, and then it can help to identify the cause. However, the CT scan is delayed because of communication gaps, maybe unclear processes or workflow challenges. At that moment, we or people usually ask, who caused the delay? Who missed the step? Who was responsible? In healthcare, we often look for the person involved in the problem. But in systems thinking, it encourages us to ask different questions. So instead of asking, who made the mistake? We ask in systems thinking, what in the system allowed the situation to happen? Was the communication process effective? Were there barriers between different healthcare teams? This shift in perspective is the foundation of today's discussion. As my classmates have already introduced the system's thinking principles, I will continue by discussing four practical tools that can help healthcare professionals analyze complex systems, understand how different functions are connected, and implement meaningful change. These tools are valuable for us, nurses, rad techs, and healthcare professionals, because safe and effective patient care depends not only on individual performance, but on how well our entire healthcare systems work together. By the end of this presentation, I hope you'll understand not only what these four tools are, but also how you can apply them in your own units to improve communication, patient safety, teamwork, and quality of care. So the first half of this presentation is the structural thinking tools. Under this category, we have graphical function diagram and structure behavioral pairs. So we will just discuss first, what is structural thinking? So why structural thinking? Healthcare is a highly interconnected system. Every patient outcomes depends on people, technology, equipment, communication, leadership policies, and organizational culture. Peter Senge explains that systems thinking is about seeing the whole rather than isolated events. For example, in medication errors, um, if this already or frequently occurs in our unit despite repeated education, perhaps maybe the education isn't the problem. Maybe the nurses are interrupted too often, maybe staffing is inadequate, or maybe the medication room layout causes distractions to the staff. So instead of repeatedly fixing the symptoms, systems thinking encourages us to examine the underlying structure. This is exactly why structural thinking is important. It shifts our focus from blame to improvement. Structural thinking tools helps us visualize how healthcare systems function and understand relationship behind our daily processes. So instead of asking only what happened, they helps us explore why this pattern continue to occur. Today, we will discuss two important tools. So under structural thinking tools, we have a graphical function diagram or also known as GFD. This tool helps us understand how functions and workflows connect within a system. And the second is structure behavior pairs. It helps us to recognize how system structures influence repeated behaviors and outcomes. Together, these tools helps us identify opportunities to improve healthcare system. So what is GFD? GFD is a visual map showing how different functions work together to achieve a desired outcome. I would like to highlight, notice that I said functions, not people. This distinction is fundamental in systems thinking because our goal is not to assign responsibility. Our goal is to understand how the system operates. This is imperative because systems thinking focuses on how work is organized rather than who performs it. Let's look at this example. So we have a patient that was admitted in the hospital, and the nursing did, of course, our initial assessment and coordination, and then the labs and the imaging rad techs will do the imaging, and then it can help support the decision making for our patient. And then our physician will develop treatment plan individualized for the patient. And then throughout the admission course, we will give family education or patient education. And then successful discharge will follow afterwards. And then, of course, there will be continuous feedback from us and the patient. Okay, so now let's ask ourselves a question. What do you think will happen if patient or family education in this diagram was removed or ineffective? What do you think could happen before the discharge? So from my side, I think there will be poor continuation of care in the home care. Of course, the patient will be readmitted soon. Also, there will be complications for the patient. So this things or this diagram evidently shows that every function contributes to the patient outcome. So if you will remove one, it will affect the outcome. One weak function affects the entire system. So what is the purpose of the graphical function diagram of GFD? So its purpose is to visualize how different functions are connected, identify communication gaps, and understand how each function contributes to the final outcomes. Some advantages are that it simplifies complex processes, improves communication among healthcare professionals, and help leaders identify areas for quality improvement. Also, however, there are limitations. A GFD can become complex in large organizations, and its accuracy depends on having complete and reliable information from everyone involved. Once we have mapped the system, the next question becomes, why do certain behaviors continue to occur? That leads us to our second tool. So our second tool is named structure behavior pairs. This is one of my favorite concepts in systems thinking, structure behavior pairs. So it teaches us that organizational structures influence people's behaviors. For example, poor staffing often leads to burnout, as you can see here in the screen. Then, poor communication systems increase medication errors. Punitive cultures reduce incident reporting, while on the other hand, good teamwork improves patient safety. Supportive leadership improves staff engagement. So, the important lesson in this is that people usually behave according to the systems they work within. The purpose of structure behavior pairs is that um, is to identify the organization structures that create recurring behaviors and outcomes. Instead of blaming individuals, this tool encourages leaders to improve the system itself. One of these advantages is that I think it promotes systems thinking, supports long-term solutions, and help nurse leaders or healthcare administrators to identify the root causes rather than simply treating the symptoms. One limitation of this is that changing organizational structures often requires leadership support, time, and resources. Not every structural problem can be solved quickly. Nevertheless, it reminds us that sustainable improvement begins by improving the environment in which people work, not simply asking people to work harder. So this is the structural thinking tools illustration. I was just want to show an idea or to show you how it works. So let's go on now to the second type of systems thinking tool, which is the tools to identify and test change within the healthcare system. So after understanding how a system works, the next step is determining how we can improve it. So instead of asking what went wrong, these tools under this category encourages us to ask, how can we create meaningful change? So in this part, we have the six thinking hats and collaborative problem solving. So the tools for to identify and test change, it helps healthcare teams explore different perspective, develop solutions, and evaluate improvements before implementation. So now, as we discussed these two important tools under this category, which is the six thinking hats and collaborative problem solving, this tools helps us approach complex challenges through shared understanding, collaboration, and innovation. So the system focus in this kind of tools is to create a sustainable change and not just quick fixes. So let's go dig deeper to the six thinking hats. Once we understand the problem, we need a structured way to think about the possible solutions, of course. So, Edward de Bono developed the six thinking hats to encourage teams to examine a problem from multiple perspectives before making a decision or making decisions. So, let's imagine our patient experiences, no, our hospital rather experiences an increase in patient falls. So, the white hat examines the data. The red hat identifies, explores emotions and concerns, and then the black hat identifies the risks. The yellow hat looks for opportunities, and green hat encourages creative ideas. Finally, the blue hat organizes the discussion into an action plan. The purpose of this tool is to improve decision making by encouraging balanced and comprehensive thinking. Its advantages are that it promotes creativity, reduces bias, encourages participation from every team member, and organizes discussion in a structured way. However, its limitation involves that it requires practice and good facilitation. During emergencies, there may not always be enough time to use all these six perspectives. This method improves communication because everyone explored the same problem using different perspectives rather than defending individual positions. So the next topic will be the collaborative problem solving. We know that no healthcare professional can solve today's complex healthcare challenges alone or by themselves. Healthcare is delivered by teams, not individuals. Collaborative problem solving tool recognizes that complex healthcare challenges require the combined expertise of multiple disciplines. Let's consider the care of a patient with complex neurological condition. The physician evaluates medical stability and coordinates the overall treatment plan. And then the rad tech performs diagnostic imaging that supports the clinical decision making. The artist supports with the respiration of the patient. And then the nurses continuously assess the patient's condition and coordinate ongoing care. Also, the rehabilitation therapists provide support for mobility, function, and ongoing care until recovery. And then dietitians, they optimize nutritional status to support healing and rehabilitation. And also families provide ongoing care and support after discharge. So no single professional can accomplish this alone. The purpose of collaborative problem solving is to bring different healthcare professionals together and to analyze problems, make shared decision, and develop sustainable solutions. Its advantages include improved communication, stronger teamwork, greater staff engagement, and more comprehensive patient care plan. more individualized patient care plan. However, its limitation includes that collaboration can be time consuming, so we know that. And differences in opinions and communication styles can create conflict if not managed effectively. So as a like me, I work in a rehabilitation hospital. This is really happening to us whenever we're doing our interdisciplinary meetings or our collaborative communication or problem solving when we face an issue. So, however, when guided by effective leadership, collaboration often produces better outcomes than working in isolation. So, of course, if the whole IDT works together, it can improve greatly the patient's outcome. So this is the illustration of the tools to identify and test change. So as you can see here, the six hats, and then the collaborative problem solving, just to have you like an illustration. So to summarize today's discussion, I would like to summarize it with one important message. Healthcare problems are really caused by one individual. Most problems emerge from interactions among people, sometimes processes, technology, communication, and organizational structures. So graphical function diagrams helps us see those interactions, while structured behavior pairs helps us understand why patterns continue. The six thinking hats helps us to think more effectively, while collaborative problem solving helps us implement sustainable solutions. So these tools remind us that improving healthcare begins by improving the system. Every day, nurses, RadTechs, and healthcare professionals make decisions that influence patient outcomes. However, systems thinking reminds us that healthcare challenges are rarely caused by individuals alone. They often result from the way our systems, process, communication, and structures are designated or designed, rather. So, in conclusion, the four tools we discussed provide practical approaches to improve these systems. The graphical function diagram helps us understand how processes are connected. Structure behavioral pairs helps us recognize how structure influence behaviors and outcomes. On the other hand, six thinking hats promotes broader perspective in action or decision making, while collaborative problem solving supports sustainable solutions through teamwork. Um, to everyone, I would just like to leave this key message that I hope everyone will remember. When something goes wrong in your unit or in your hospital, let's not ask who made the mistake, but instead, let's ask, what in our system allowed this to happen and how we can improve it? Healthcare excellence is achieved not only by asking individuals to work harder, but by designing systems that enable safe, effective, and patient centered care. By embracing systems thinking, we move beyond solving isolated problems and begin creating lasting improvement for our patients, teams, and organizations. So, these are all my references for these presentations. I would like to thank everyone for your time and attention. So, let's not forget the four tools that I've discussed today. Thank you, everyone, and God bless.